what are some of the most effective ways you found over the years to manage the most common symptoms of mesothelioma and post-surgery? And in addition to that, how it might have changed over the years?
I would say the biggest, sometimes a big side effect we'd see from surgery or things that people would, talk about is shortness of breath. Oh, I become winded after I walk to the kitchen and I come back. I think we would always encourage people to weigh themselves daily to make sure that their fluid intake wasn't, catching up with them and like their feet weren't getting swollen or they weren't putting on weight because, that's an easy fix, right? You can get a diuretic from one of the surgeons. And I think, too, the other piece is that, not everybody or at home who is recovering or wherever they're recovering wants to get up and move. And I'd say that regardless of how you feel, sometimes it was a real push to get people to move and walk and, get out of their own heads. And I think those were big things that we were challenged by them, by some people. Some people just went along easily, but some people really was like, no, I can't do it. I'm too sick. They just were so overwhelmed by their disease and, what had happened to them and how long they've been in the hospital for that, their minds just kind of took over for a bit. I would say that those were the big side effects that I think we experienced. Wouldn't you, Ellie?
Yep. And the only other one I would add would be pain. Some people, like I said before, some people just, like they expect they expect to be in pain. They expect it to be, that they accepted the better word is they accepted that they were in pain when in fact that, they weren't taking their medications or they didn't understand that they could take the medications. And then there was the other side of people that, you had to really kind of push them and encourage them and say, it will get better, but you have to move. Right. I think the mobility issue, is kind of come full circle. I can remember many in the 1990s, Dr. Sugarbaker, all his patients had to get up out of bed and walk. And that was something new. And now, and we did that for years. All the patients, everyone had to walk. They had to get out of bed 3 times a day, even if you're in the ICU. And now there's this whole movement in the ICU. And they're making a big, deal about it, that everyone should get up and move. And it's like, well, we've been doing that for 20 years.
Yeah.
But it's proven that if you get up and move, and when you're sick like that, sometimes that's the last thing you want to do.